Hi, my name is Romaisa Perves. I'm a youth research assistant at Minds, and today I'll be talking about one of our projects titled Safe and Accessible Transportation for Rural Youth in Mental Health Crises, a Minds social innovation initiative. First off, what is MIMES? The Mental Health Incubator for Disruptive Solution of London Middlesex is a social innovation lab that uses a collective impact framework to strategically develop and evaluate high potential interventions that tackle the complex and growing problem of mental ill health and addiction in transitional aged youth, who are individuals between the ages of 16 to 25. As a part of the collective impact framework, Minds engages and innovates directly with key community stakeholders through yearly convenings, including mental health organizations such as CMHA, Youth Opportunities Unlimited, clinicians, researchers at Western, and most importantly, youth. In the most recent convening hosted by Minds in 2019, youth highlighted the inaccessibility and varied barriers to mental health services for youth living in rural communities. Road to Mental Health, which is a tax-free service for youth in mental health crises, is an initiative that was brought forth by youth at the convening and was further cultivated by working groups that consisted of representatives from the Middlesex County Libraries, CMHA, Star Taxi, which is a local taxi company, and Minds. There are currently limited transit options for transitional aged youth in mental health crises from rural Middlesex to London, where majority of the mental health services are located. The options that are available have their own added barriers. There are limited bus routes and bus times. It's expensive to take the taxi. They can ask their parent or guardian for a ride, but would have had to disclose this information to them. The initiative aims to address this existing gap in mental health services for youth in mental health crises by providing youth in rural areas with free and safe transportation to support services in London. In collaboration with our partners, we hope to ease the barrier of accessibility and provide youth with the opportunity to access services when they need them, not hours, days, or even weeks later. For the purposes of this pilot, the taxi company is serving areas in Lucan, Parkhill, Strathroy, and Exeter. We kept the reach to those specific areas as we have limited funding, which means we have limited number of rides that can be compensated. So how does our initiative work? Youth in mental health crises will connect with CMHA's Reach Out 24/7 line, either online or over the phone. They will then be supported and assessed by the crisis line staff. If it is determined that a visit to the London Crisis Centre is needed, the CMHA crisis worker will ensure a smooth transition from the crisis line to the Star Taxi service. Their youth will then be provided with free transportation to and from CMHA's crisis centre located in London. To ensure the safety and well-being of the youth accessing the service, Star Taxi drivers have received training in crisis de-escalation, mental health literacy, and also suicide prevention. We're currently in the process of expanding the initiative to cover not only transportation for youth in crises, but also for those who would benefit from access to mental health services more broadly, including appointments and group sessions that can be difficult to get to otherwise. For the pilot, Star Taxi will be providing Tay with transportation to services at FEMAP, which is First Episode Mood and Anxiety Disorder Program, and CMHA. We have limited the service providers to just these two centers to ensure we're not overextending our capacity at the current moment. Once the pilot ends, we hope to gather feedback on the usage and Tay's experience to adjust the program accordingly. In regards to our methods, this concept of this initiative was ideated by youth at the Minds convening. And in keeping with social innovation approach, the development of the prototype is ongoing, iterative, and collaborative. Currently, demographic information of users will be collected, such as the age, location, upon arrival at the crisis center. Youth users will be asked to elaborate on their personal experience of the service, such as their comfort, safety, and support as well. And as of now, the pilot and evaluation efforts are ongoing. There's been limited usage so far, which was expected due to COVID-19 restrictions. However, we hope that the usage will increase now that restrictions are slowly being lifted. For our next steps, we hope to adapt the program to better reflect the feedback collected through the survey on impact and usage. We anticipate expanding the reach of the program to include the broader rural Middlesex County and also include other mental health services in the community. If youth are able to access mental health services more regularly, the likelihood they will need to rely on taxi service when in mental health crises will be substantially decreased. And it's this type of proactive approach that we anticipate meeting as the scope of the initiative is able to grow. That concludes my presentation for today. Thank you for listening.